Assalamualaikum warahmatullahi wabarakatuh. I am Putri Cahya A from English Literature B. Today we're gonna discuss about speech disorders. Speech is the process of producing specific sounds that convey meaning to the listener. A speech disorder refers to any condition that affects a person's ability to produce sounds that create words. Speech is one of the main ways in which people communicate their thoughts, feelings, and ideas with others. The act of speaking requires the precise coordination of multiple body parts, including their head, neck, chest, and abdomen. In this presentation, I'm going to tell you about what speech disorder is, the different types of speech disorder, the causes, and also how to deal with it. First, what is speech disorders? Speech disorders affect a person's ability to form the sounds that allow them to communicate with other people. They are not the same as language disorders. Speech disorders prevent people from forming correct speech sounds, while language disorders affect a person's ability to learn words or understand what others say to them. However, both speech and language disorders can make it more difficult for a person to express their thoughts and feelings to others. Second, the types. Speech disorders can affect people of all ages. As you can see, these are some types of speech disorders: stuttering, apraxia, and dysarthria. We are going to discuss it in the next slide. Stuttering. Stuttering refers to a speech disorder that interrupts the flow of the speech. People who stutter can experience like repetitions, blocks, and prolongation. Repetition happens when people involuntarily repeat sounds, vowels, or words like this, like I'm gonna. That's the repetition in the word I. Then block happens when people know what they want to say but have difficulty making the necessary speech sounds. Blocks may cause someone to feel as though their words are stuck. They feel they they feel their words are stuck. Sorry. Prolongation. Prolongation is stretching or drawing out of particular sounds of the words. The symptoms of stuttering can vary depending on the situation, like stress, excitement, or frustration can cause stuttering to become more severe. Some people may also find that certain words or sounds can make a stutter more pronounced. Stuttering can cause both behavioral and physical symptoms that occur at the same time. These can include tension in the face and shoulders, rapid blinking, lip tremors, clenched fists, and sudden head movements. The second is apraxia. The brain controls every single action that people make, including speaking. Most of the brain's involvement in speech is unconscious and automatic. When someone decides to speak, the brain sends signals to the different structures of the body that work together to produce speech. The brain instructs these structures how and when to move to form the appropriate sounds. For example, these speech signals open or close the vocal cords, move the tongue and shape the lips, and control the movement of air through the throat and mouth. Apraxia is a general term referring to brain damage that impairs a person's motor skills, and it can affect any part of the body of the person, Apraxia of speech, or verbal apraxia, refers specifically to the impairment of motor skill that affect an that affect an individual's ability to form the sounds of speech correctly, even when they know which words they want to say. The last is dysarthria. Dysarthria occurs when damage to the brain causes muscle weakness in a person's face, lips, tongue, throat, or chest. Muscle weakness in these parts of the body can make speaking very difficult. People who have dysarthria may experience the following symptoms: slurred speech, mumbling, speaking too slowly or too quickly, soft or quiet speech, and difficulty moving the mouth or tongue. And we come to the most important discussion, that is how to deal with speech disorders. We can prevent the symptoms of the speech disorders by doing the following things. First, don't be in a hurry. Speak slowly and calmly. Second, take a breath every time we start having trouble talking. Third, don't think about whether we can speak or not about something. Usually, when you think about it more, it will turn out badly when you speak. Speak as if it were spontaneous. This method really works. And you can also try speech exercise by reading book aloud. It can help smooth your speech. Apart from self-prevention, we can also ask experts for help. But sorry, we're not gonna discuss it today. You can find it yourself. There are many treatments regarding speech disorders on the internet or maybe in books. Okay, here we are at the end of the presentation. The conclusion is speech disorders affect a person's ability to produce sounds that create words. They are not the same as language disorders, which make it more difficult for people to learn words or understand what others are saying to them. Types of speech disorder include stuttering, apraxia, and dysarthria. There are many possible causes of speech disorder, including muscle weakness, brain injuries, degenerative diseases, autism, and hearing loss. Speech disorders can affect a person's self-esteem and their overall quality of life. However, we can try to overcome it by reading exercises, breath controlling, and many more. Sometimes we can also do anxiety medication.